Good afternoon and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. These are some of the highlights this hour. Association of Resident Doctors in ABUJA begin indefinite strike action, demand payment of COVID-19 hazard and inducement allowance, among other demands. Plateau Correctional Center adopts COVID-19 safety guidelines to prevent spread of coronavirus in its facility. And nearly 1.4 million children in Wuhan, eastern China, go back to school in a city where coronavirus pandemic started in December after enduring nearly 11 weeks of lockdown. Welcome everyone to the program. Nigeria continues to record lower cases of the SARS-CoV-2 virus, COVID-19, with 143 new cases announced by the Nigeria Center for Disease Control, NCDC, and no deaths recorded in 24 hours. While the country's total confirmed cases has passed the 54,000 mark, the Presidential Task Force, PTF, on COVID-19 is still calling for vigilance that the virus is still potent and dangerous. The chairman of the task force made the comments in reference to the lowest infections, 138 reported Sunday night, the lowest in 4 months. According to the NCDC, the new cases are reported in 17 states and the Federal Capital Territory, putting the number of confirmed infections in the country at 54,008. According to data from the Center for Disease Control, Nigeria's new pandemic hotbed, Plateau State, had the highest number of infected persons for the day, with 35. Kaduna had the second highest at 21. Lagos State recorded 19 fresh cases of the virus, the FCT 13, 9 in Ebonyi, 7 in Adamawa, 7 also in Enugu and Katsina states. 6 were recorded in Edo, 5 in Kwara. 3 new persons were infected in Osun State, 2 in Anambra, 2 as well in Kano and Niger states, also in Ogun State, while 1 each in Benue, Borno and Sokoto states. That's over 1.2 million, with total deaths at almost 30,000 and recoveries approaching the 1 million mark on the continent. Now, doctors in Nigeria's capital, Abuja, have begun an indefinite strike over the non-payment of what they call COVID-19 hazard allowances and other benefits since April. The Association of Resident Doctors said the authorities had failed to fulfill promises made to staff working in coronavirus isolation and treatment centers, as well as in hospitals. It said the strike comes after the authorities were given a 14-day ultimatum. The authorities have not yet commented. The doctors say they will not go back to work until their demands are met. And with Nigeria's cases at over 54,000, Abuja is the second worst hit city after the commercial hub Lagos. And it also has the highest number of cases on admission at 3,583. Now, we're going to be talking to the chairman from Abuja in a short while, but let's take you to Adamawa State now, where the government has expressed displeasure with proprietors of private schools for reopening primary schools without the consent of the state's Ministry of Education. The Adamawa State Commissioner for Education and Human Development said this during a meeting with officials of the state chapter of the National Association of Proprietors of Private Schools in Yola, the Adamawa State capital. The ministry says it has not instructed the reopening of primary schools nor the conduct of common entrance examinations in the state, frowning at the situation where officials sent by the ministry to monitor compliance of schools in line with the COVID-19 guidelines were prevented from doing so.
For 6 months, schools nationwide have been closed due to the COVID-19 pandemic. Now things appear to be looking up in the education sector as the federal government has allowed secondary school students in exit classes to return for their final examinations. In Adamawa State, however, private primary schools have been operating for a month and are even preparing for national examinations into secondary schools. This meeting at the conference hall of the State Ministry of Education is taking place between the state government and the executives of the National Association of Proprietors of Private Schools to correct the anomaly.
It's already an accident that the pandemic has affected all the nations of the world. But we the trust that the schools can guide the children behaving and also maintain the social distance.
The chairman of the Adamawa State Chapter of the National Association of Proprietors of Private Schools assures of compliance by members, while the State Commissioner of Education insists that the COVID-19 guidelines must be followed by all stakeholders.
The National Policy on Education did not state that primary 6 should write any common entrance. That's what we explained to them. It is all about automatic promotion. No one is demoted. So that's not an excuse as far as we are concerned. COVID-19 is the excuse. We are here to obey guidelines according to Federal Ministry of Education on COVID-19.
As the students wait for the go-ahead to return to school, there are some concerns. Are the schools ready to put all NCDC protocols in place? Are the students themselves enlightened about the COVID-19 pandemic? In the coming days, any gaps will be apparent, and relevant authorities should be prepared to wade in and close those gaps.
Let's go back to the story of the doctors in Abuja and the strike. Dr. Roland Agbovo, Chairman, ARD, Abuja, he joins us via telephone. Thank you for joining us on the program. Give us an update as to why the association is embarking on this strike.
Hello.
Yes, Dr. Agbovo, I hope you can hear me. Just give us an update on why, thank you very much, on why the doctors in Abuja are embarking on this strike at this very moment, and if it only has to do with the doctors who are working in the various isolation and treatment centers.
All right, thank you. We are embarking on this strike action now because FCTA management have refused to, or rather have reneged on their promises to pay the COVID-19 hazard allowance. So we recall that the Nigerian Association of Resident Doctors embarked on a strike action on this same issue sometime in June. And we had assurances from the FCTA management that ours will be paid. Up till now, this moment I will speak, the allowances is yet to be paid. Though those in the isolation and treatment centers have received their payments up to May, but those working outside of the isolation center have not received any allowances up to this moment. And we had a series of engagements from with FCTA management at top level, and we keep hearing is promises, and the promises were not being kept. They reneged on their promises, and now we decide to take this action to press on our demand. And apart from the COVID allowance, another issue is the non-implementation of variation for our members who were successful in the 2018 promotion exercise. They've done their variation for 4, 5, 6 months now, and up till the last month, August, they were still receiving their old salaries. And these have been, the attention of FCT management have been drawn to this. And except when these salaries is paid for September, we'll know if the variation has been implemented or not. But all engagements with FCTA management have actually yielded the necessary results. And most especially, this whole process was stalled by the Office of the Permanent Secretary, because we followed up on all these discussions and the bureaucracy. But unfortunately, at every time the file gets to the Permanent Secretary's office, it spends weeks there without being attended to. And we felt that things are not done this way. That's a high level of insensitivity to the plight.
Many people have said that, aren't you holding the FCT to ransom, seeing as, we are fighting a pandemic? Couldn't you, for example, talk some more and try to talk with them to see how they can listen to some of the demands that you've requested for?
Yeah, we are still engaging them. No, it's just that this strike action is regretted, but it just seems to be the only avenue which we can get our entitlement. We've been engaging FCTA management before now, and in short, just this morning I got a call that the minister has approved the payment, the payment of the COVID-19 allowance. Personally, I don't think we have to get to this level because things begin to move fast. We actually, if we wanted to go on strike, would have joined the national body or called back on this strike action long before now. But we've given enough time since June. This is the 1st of September. I think we're giving enough time. People have been working, and even those in isolation center are also included. Even those in isolation center are also included in the strike action. So that makes the whole thing a bit.
I think we understand you. We'd like to thank you. We'll, of course, wait to see as things develop in the story. Thank you. We've been talking to Dr. Roland Agbovo, Chairman, Resident Doctors Association, Resident Doctors in Abuja. Thank you for joining us on the program. Now let's go over to Plateau State. But before that, let's bring in our guest who's joined us here in Lagos, Dr. Shalom Oni. He's a public health physician. Thank you for joining us on the program.
Thank you, Millicent.
All right. So some people would say one strike too many, and it's recurring. I mean, if it's last month, this month, from one state to the other. What do you think is the solution?
Well, it's a sad development, really, because if at the peak of pandemic, doctors who are frontline health workers are being owed allowances, it's a sad situation, because they risk their life, to take care of the country. So for me, everything boils down to proper planning. Before you enlist a set of individuals in a pandemic fight, there must have been a plan, a budget, remuneration, and things like that. Budget was submitted. It was approved, then implement. So there shouldn't be a challenge, but it's Nigerian system.
But sometimes some people argue that some of these demands that are recurring are perhaps promises made years back.
Well, not exactly, because there are promises like what you heard from ABUJA resident doctors now. Now, it's not just only about promises made in time past. Perhaps they are using this COVID thing to also remind the government about the failed promises in time past. See, this is the issue. It's an issue of trust. If you have been meeting up with previous promises and demands, if government is asking for patience this time around, you would. But then when there are cases of repetition of failed promises, then you want to hold the government to the jugular.
Let's talk some more as to the presidential task force. They admitted to testing scaling down and saying that what we are seeing in terms of the cases, not necessarily that the virus is reducing. So essentially, we can say that we don't have a true picture of the curve that we're fighting to flatten.
Well, it's looking like that because for me, it's strange if right now we're scaling down testing, because this is the time to even scale up testing. That is, you want to get worried if you are having lesser cases on a daily basis nationally. You want to see that, are you really doing the right thing? Are the right set of people coming forward for testing? Because right now, many people want COVID testing because they want to go back to work. They want to travel. So they may not be the right set of people that you are catching. So you want to get worried that, are we really, doing the right testing? Number one, our capacity has it reduced or we have increased? If it has, then are we testing the right set of people? Because right now, we want to do massive scale testing to really know the true picture. Now, Nigeria has not really bought into the idea of rapid testing. Some of the test kits that were released at one time were failed NCDC testing. But now, there are some countries that they are using the rapid testing. So we need that to know the prevalent level of COVID-19 right now. So it's not just PCR. Right now, we should go beyond PCR and be using the rapid testing to know how many people have had COVID and have recovered, because a lot of people have had COVID and have recovered. It is not the picture we are seeing on a national broadcast. It's beyond that. Now, look at Lagos, for example. The number of people that recover from COVID at home, about 13,000 plus, is more than those who recover from COVID in isolation.
Indeed, talking about
2,000 plus. Yeah, so you want to look at that, scale up that to the national level too, that maybe we need to adopt a rapid diagnosis testing to know the prevalent level of COVID nationally. I'm sure if we do that, we're going to get down in millions.
All right. We'd like to thank you, public health physician, Dr. Shalamuni. Thank you for joining us on the program. We have more on the COVID-19 updates when we return. Please stay with us. Authorities at the Just Custodial Center of the Nigerian Correctional Service are not taking chances in ensuring that the coronavirus pandemic does not spread among inmates at the facilities in the 6 centers in the state. With the provision of all required protocol materials for inmates and visitors alike, the state's controller of the Correctional Service, Mrs. Samuel Aguda, says samples of inmates were taken for testing, and those that tested positive, about 10 out of 57, have been taken into isolation for treatment and subsequently brought back to the center after treatment, and their results turned negative. And over in Minna, the Niger State capital, our correspondent Simon Emperor brings us this update as regards the efforts to increase the COVID-19 awareness.
From just a single case of confirmed positive case of COVID-19 as at April this year, Niger State currently has a total of 242 confirmed positive cases of the virus with 12 deaths. Though it's now at a minimal stage, the goal of the state government is to completely flatten the curve of COVID-19. But how possible can that be? The chairman of the Nigerian Red Cross Society of Nigeria, Niger State Chapter, says to achieve that, the state government will have to collaborate with civil society organizations in the states.
The pandemic is real, and that is why our volunteers are out there to let people know that this pandemic is real. But then you can avoid it by going through the protocols as set.
To strengthen the collaboration between the state government and the civil societies of Nigeria, the International Federation of Red Cross, in collaboration with the National Society, recently organized a training workshop for volunteers of the Nigerian Red Cross Society, Niger State Chapter. So we decided to engage one of the participants at that training on the knowledge he has acquired and how he intends to apply it.
During this pandemic, most of the people run away from hospitals because they think they have fever, they go to the hospital, the next thing is the isolation. So we have more knowledge on sensitize people to remove that fear in them, to be able to visit the medical facilities.
At the moment, all the safety measures that the Niger State government has put in place, including the ban on interstate travels, are still intact. From Niger State, Emperor Simon for COVID-19 updates.
Researchers around the world are racing to develop a vaccine against COVID-19, with more than 170 candidate vaccines now tracked by the World Health Organization. Vaccines normally require years of testing and additional time to produce at scale, but scientists are hoping to develop a coronavirus vaccine within 12 to 18 months. Joining us here in the studio is Dr. Sam Amao. He's a research fellow at the Nigeria Institute of Medical Research, NIMA. Thank you for joining us on the program.
Thank you. I'm glad to be here.
All right. So vaccine research worldwide, also at NIMA. How far are things moving along?
Well, thank you once again. Vaccine research, NIMA is not lagging behind in vaccine research. We have work ongoing, though being silent on it at the moment. Okay. However, as you've been actually alleged, vaccine is not a 100-meter race. It takes time, it takes resources, it takes people to commit themselves to it. So the government has actually put the NIMA requirement in place, and I think over the world, what people should realize is that to fund this vaccine research, the private sector must come on board. The pharma companies, yeah, because mostly vaccines actually are not being produced for the gain of it, not for the profit, but actually for the purpose, which is also to save humanity and to prevent lives from disease like COVID-19. So we need not leave this to the government alone. So NIMA is open for such collaboration with pharma companies to come and see what already on ground have been doing, so that we can take it up from there.
I want to talk about the our testing capacity so far, and seeing as July and August, it appeared that testing was lower in August, and this is also from allegations, from the PTF and some of the things they said yesterday. But we know that NIMA has a sort of on-site collection of samples for COVID-19. How is that moving along? And if you compare maybe July figures when it started to August, were they more or lower? Are you also facing the same challenge?
I won't say we are facing such challenges because then, even as at 10 yesterday, we still were able to test over 90 people on the site. And meaning that people are still coming for testing.
And is that the usual number, 90 a day?
No, not the usual number. We see that sometimes between 80 and 150 in a day. Sometimes it fluctuates within those figures. And then I know that there will be more room to test just because the center could not accommodate much. We have over 23,000 people that are registered on our platform, so showing interest to test. And then as at now, we actually invite within 24 hours of registration. So people are aware, for whatever reason, are still coming to test. But I will agree with the report because, and again, the seeking behavior of the people is becoming alarming. People are taking it more lightly compared to 3 months ago. So this could be one of the factors responsible for low turnout of testing.
But isn't that an advantage, showing that people are no longer afraid of the virus? But of course, they need to take the necessary precautions, and if they have symptoms, come and test.
Yeah, that's dicey. Well, we need not to be afraid of the virus in the first place. We need to take care of it. So if we are coming to test because we are afraid, then there's an issue. We don't have the understanding yet. We need to come and test because we want the virus to go away.
The rapid test kits, how soon can we validate one to really scale up our testing?
Well, maybe I'm not permitted to say this, but I will just let you know that there is a project coming up again in the month of this same September, a nationwide study trying to validate some of those immunological kits. We're going to run it in Lagos and other 7 states in Nigeria. So after that, we can now say whether this is very useful in our environment or not. But for now, we still stick to the qPCR testing methodology.
Thank you so much, Dr. Sam Amao, Research Fellow at NIMA. Thank you for joining us on the program.
You're welcome.
Nearly 1.4 million children in Wuhan, eastern China, have gone back to school or nursery in the city where the coronavirus pandemic started in December. Life has largely returned to normal in Wuhan, where the coronavirus was first detected. It marked a milestone on Sunday when its last confirmed case, a patient who brought the virus from overseas, was released from a city hospital. Here's more on our global update.
Children returned to school on Tuesday in the central Chinese city of Wuhan, the original epicenter of the coronavirus epidemic that underwent months of lockdown, but which has not seen new cases of local transmission for weeks. State media reported 1.4 million children in the city reported to 2,842 kindergartens, primary and secondary schools as part of a nationwide return to classes. Similarly, in France, 12.4 million children are heading back after a very long summer break. President Emmanuel Macron says the challenges are numerous, but he has appealed to everyone to adopt the same responsible approach as they have for months. Meanwhile, new rules on the wearing of face masks in workplace come into force in France. Hong Kong has started mass coronavirus testing under a new scheme backed by the Chinese government. The voluntary mass testing is being conducted with the help of medical staff from mainland China. A health workers union has criticized the effort as an inefficient waste of resources, while activists have said it could be used to collect DNA samples.
Now, over the course of the last
authorities say inmates at a high-security Australian prison lit fires, smashed windows and flooded their cells with water on Tuesday after a lockdown sparked by the coronavirus outbreak resulted in a shortage of staff and services. The unrest began a day earlier at the Arthur Gorey Correctional Centre in the city of Brisbane. 4 days after the local media said the prison went into lockdown due to 2 staff testing positive to COVID-19. The authorities say a shortage of replacement staff, while existing staff stood down to get tested for the virus, had resulted in problems delivering basic services like meals and medication.
And we understand that Russia surpassed the 1 million mark in total coronavirus cases today. This is after schools resumed. You can take a look at our website, channelstv.com. You find that story and several others on the pandemic. That's channelstv.com. That's the program this afternoon. Thank you for watching. I'm Millicent Walker. Stay safe.